In this podcast episode, Dr. Jaquel Patterson delves into the alarming rise in mental illness, exploring the multifaceted causes and potential solutions through a functional medicine lens. The conversation highlights the inadequacies of traditional psychiatric approaches and emphasizes the need for a more holistic understanding of mental health. Dr. Patterson opens the conversation by addressing the escalating rates of mental illness, including depression, anxiety, ADHD, bipolar disorder, and suicide. The statistics are staggering, particularly among adolescents, where nearly 1 in 3 individuals experiences anxiety and about 15% suffer from depression. The traditional psychiatric model, which often relies heavily on medication, has not effectively addressed this crisis. Despite the proliferation of psychiatric drugs, many patients do not experience significant improvement, and the effectiveness of these medications can sometimes be no better than a placebo. Dr. Patterson reflects on her medical training, noting that psychiatry often classifies patients based on symptoms without adequately exploring the underlying causes of mental illness. This approach has led to a disconnect between the mind and the brain, with many psychiatrists neglecting the biological and physiological factors that contribute to mental health disorders. The conversation emphasizes the importance of understanding brain dysfunction as a key component of psychiatric illness, as it manifests through various symptoms rather than direct pain or discomfort. A significant focus of the discussion is the role of neuroinflammation in mental health. Dr. Patterson explains that inflammation in the brain can lead to a range of psychiatric symptoms, including anxiety and depression. This inflammation can be triggered by various factors, including chronic infections, environmental toxins, poor diet, and stress. The conversation highlights the need to identify and address these underlying causes rather than merely treating the symptoms with medication. Dr. Patterson shares her experiences treating patients with Lyme disease, noting that as she addressed the underlying infections and inflammation, many patients experienced significant improvements in their mental health. This observation led her to pursue further training in functional medicine, where the focus is on identifying and treating the root causes of illness. The discussion also emphasizes the critical role of diet and nutrition in mental health. Dr. Patterson points out that many patients are deficient in essential nutrients, such as magnesium, zinc, and B vitamins, which are crucial for maintaining optimal brain function. She highlights the importance of a balanced diet rich in colorful, plant-based foods, as well as the potential benefits of specific supplements, such as amino acids and adaptogens, in supporting mental health. Dr. Patterson notes that many individuals are unaware of how their dietary choices impact their mental well-being. For example, a diet high in processed foods can contribute to systemic inflammation, exacerbating mental health issues. By encouraging patients to adopt healthier eating habits, she has seen significant improvements in their mental health outcomes. A fascinating aspect of the conversation is the connection between gut health and mental health. Dr. Patterson explains that the gut microbiome plays a crucial role in regulating mood and behavior. Dysbiosis, or an imbalance in gut bacteria, can lead to increased inflammation and contribute to mental health disorders. She discusses the emerging field of psychobiotics, which focuses on the use of probiotics to support mental health by promoting a healthy gut microbiome. Dr. Patterson shares her experiences treating children with conditions like pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, and how addressing gut health has led to remarkable improvements in their symptoms. She emphasizes the importance of looking beyond traditional psychiatric treatments and considering the broader context of a patient's health, including their gut microbiome. The conversation also touches on the impact of stress and trauma on mental health. Dr. Patterson explains that chronic stress can lead to dysregulation of the body's stress response systems, resulting in increased inflammation and a higher risk of mental health disorders. She highlights the importance of addressing trauma and its long-term effects on mental health, particularly in children who may be more vulnerable to the impacts of adverse experiences. Dr. Patterson shares a case of a patient who experienced a significant loss, leading to a resurgence of mental health symptoms. This underscores the need for a comprehensive approach to mental health that considers the emotional and psychological aspects of a patient's experience. Throughout the discussion, Dr. Patterson emphasizes the importance of community and social connection in supporting mental health. She notes that loneliness and isolation can exacerbate mental health issues, and fostering connections with others can be a powerful tool for healing. The conversation highlights the need for a supportive environment where individuals can share their experiences and find solace in community. Dr. Patterson discusses various innovative approaches to treating mental health disorders, including the use of sauna therapy, forest bathing, and other lifestyle interventions that have been shown to reduce inflammation and improve mental well-being. She shares research indicating that these practices can lead to lower rates of conditions like schizophrenia and anxiety. The conversation also touches on the potential benefits of dietary interventions, such as the ketogenic diet, in managing mental health disorders. Dr. Patterson notes that metabolic psychiatry is an emerging field that explores the relationship between metabolic health and mental well-being, offering new avenues for treatment. As the conversation draws to a close, Dr. Patterson expresses hope for the future of mental health care. She believes that a shift toward a more holistic, integrative approach that considers the interconnectedness of the body and mind is essential for addressing the mental health crisis. By focusing on root causes, such as inflammation, gut health, and nutritional deficiencies, practitioners can provide more effective and lasting solutions for their patients.